Hi, I'm Dr. Castanet, and I'm going to explain to you how spinal decompression works for a neck problem. This is Mary Ann. She's going to be our model here. I have her set up in the cervical spinal decompression treatment. She's right back here and with her neck nestled in these little capture units here, or supports, and I have a strap across the forearm. That keeps her head down so that it continues to be captured effectively by these posts right here that are up against the back of her skull. The setup for cervical traction or spinal decompression is similar. They haven't come up with any more effective design than grasping here and here, and that's fine. For most people, this is a comfortable setup. What we have here is, and I'll explain why we do spinal decompression in just a moment, but in terms of the setup, she's resting back there, got a strap here to restrain her head down, and then this apparatus, this sled, so to speak, is set up on the computer to pull with a certain amount of tension in a certain pattern over the course of a certain amount of time. These are all parameters that we set up, and they're research-based. So let me explain what happens. With few exceptions, the reason people have neck pain and disability and pain down the shoulder and down the arm has to do with the fact that over time our spines get compressed. Pretty simple to understand. In fact, when we send people out for imaging, meaning x-rays or MRI scans, we are typically looking for compression of the spine. By that I mean that over time, if you look at people's x-rays and MRI scans, with few exceptions, people's spine gets compressed. And by that I mean that the discs that are between the bones in the neck, they lose water content, they lose some height, they degenerate. As a result of that, there's more pressure on the joints of the bones. That can be a source of pain, in addition to the disc degeneration, which can be a source of pain. That also means that the space available for the spinal cord and for the nerve roots in the neck is diminished. Spinal cord and nerve roots in the neck travel down holes. There's a central hole that goes right down the spine, and then there are little holes, a pair on each side at each level, where nerve roots exit. So over time, the degenerative changes that happen to the discs and the joints result in enlargement of the bones and reduction of the size of the holes, meaning there can be pressure on the spinal cord or nerve roots, and it's that process that gives rise to intermittent pain and disability, and eventually, if the problem gets bad enough, to constant pain and disability. So the first way that we ought to treat neck and back pain as we age is to decompress the spine. Decompression of the spine means simply pulling apart to stretch out the discs, and that results in two things, one short-lived and one longer-lived. And that explanation is prompted by the patient's questions to me always about, well, okay, I'm on the table, I'm getting decompressed, but then I get upright, and doesn't that just reverse what we just did? And the answer to that is yes and no. It does, when we have somebody on a table, we mechanically pull them apart, and we get pressure off of the discs, the joints, and nerves if they're pinched and causing pain down the shoulder blade and the arms. So somebody gets immediate relief from that. And some of those changes are lasting even when they stand up. But that has to do with mechanical, anatomical changes. What is just as important, maybe more important, is that when you distract the disc, you initiate physiologic changes. These are things that are chemical. They happen within the disc to make it a better disc. And that is longer lasting. Those changes can improve and help a person for months to years, oftentimes. What happens when you distract a disc is that you get more water, oxygen, and nutrients into that disc. That creates a better environment for the cells that live in the disc. And those cells are then able to divide and make more cells, and all those cells collectively then can make more molecules to repair the disc. We know these from animal studies, from From dissection and microscopy, we know that you can count more live cells in a disc that's been distracted experimentally. We also know through radioisotope studies where they inject chemicals that are tagged with radioisotopes that can be traced, that the cells in the disc can then make more molecules and do make 4 to 8 times as many molecules to repair the disc. So it results in a hypermetabolic state to reverse, in a meaningful way, some of the degenerative changes that have resulted in the pain and disability the person has. So this treatment, while less than perfect, and it will not give you the disc you had when you're 15 or 20 years old, is essential. And the exclusion of it in somebody's treatment for neck and back pain, I think, is foolish. And it's an oversight on the part of medicine. In any case, that's how this works. It's very comfortable. Patient lays here for about 30 minutes. The machine in a certain pattern will pull more and less. Some people fall asleep. That's actually quite common. It's that comfortable. This is part of what we do to treat people with neck and back pain, because decompression isn't everything. For some people, it's largely their problem. Maybe for many. In fact, I'd say that clinically, this is the most effective tool I've used for people in 25 years treating neck and back pain. And I mean by far the most effective tool. But there are other issues to address too for many people. We generally try to strengthen people. We try to improve the range of motion if there's a deficit in the range of motion. And all those things collectively, doing what needs to be done for the patient. Sometimes that means manual therapy too. Our physical therapists will do manual therapy with the neck sometimes as well. All those things collectively are designed to get the patient to have better range of motion, less pain, stronger muscles, better endurance, better function, and less pain. And this is an important and central component of the treatment we provide for most people with neck and back pain. So thanks for watching.